Radiesse in conjunction with Ultherapy. Any suggestions? Can I receive Ultherapy after having Radiesse injected into the nasolabial folds? Could the heat alter the chemical properties of Radiesse or possibly melt it?
Thank you for your question. You're asking a question which is a fairly common question in the current world of non-invasive skin tightening technologies. And you're asking about Radiesse and the integrity of the Radiesse currently being in your nasolabial fold, and whether it's safe to have Ultherapy at the same time, and whether it would potentially melt the Radiesse. Well, I can certainly give you a little bit of information based on how we discuss non-surgical therapies like Ultherapy in our practice. Although we don't offer Ultherapy specifically, we have technology that's comparable. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been using various thermal devices, including lasers, since the mid-90s with the original CO2 laser to help people tighten their skin. So in the modern world, we have a variety of technologies that offer basically dermal tightening as well as non-surgical fat reduction using various methods of heat induction, whether it's radiofrequency, ultrasound type of technology, as well as laser technology. So the principle of this concept is to induce a certain level of heat for a certain amount of time in order to induce tightening of the skin. And by tightening the dermis up to a point, you can actually improve areas such as jaw lines and jowls, etc. We do something we use a technology called the ND-YAG laser, which has this unique method of inducing temperature elevation in the skin in a way that's slow and progressive, so we are able to avoid some of the pain issues that people have with a lot of the more common, popular technologies. So that being said, we have this experience. As far as the effect on the Radiesse, this depends also on where the thermal energy device is being applied. In general, we don't actually treat the nasolabial fold directly. So the temperature change in the skin can probably be avoided in terms of having any effect on the Radiesse material. Understanding that Radiesse is a suspension of a material called calcium hydroxyapatite in a gel suspension, there's probably a theoretical potential because of the upregulation or the biologic increase of activity as a response to this controlled induction of heat. You could theoretically accelerate the gel breakdown, but the hydroxyapatite itself will not break down from that kind of heat. This is a material that's like bone, so it's very resistant to that type of temperature increase. So in terms of making a decision, I think you really have to discuss with your doctor what the desired outcome would be with this thermal energy device or any thermal energy device. When we look at our patients and we want to help them with whether it's dermal tightening or spot fat reduction, we have different protocols and different ways to apply the laser device without doing anything to the skin superficially, but inducing the heat into the deeper layers of skin as well as the tissue underneath the skin in a way to tighten the skin. We're able to really customize. So if we put fillers in the lip area, the nasolabial fold, or even the chin, it's not a problem, because what's really nice about using a laser device is being able to point the device very precisely and to control exactly where the heat is being applied. That's a side point, but essentially the point of that is that if you can strategically limit where the heat is being placed and preserve the integrity of the area where the fillers are placed, that's ultimately the goal. So talk to your doctor about this and learn about what the impact will be, and also learn about what the success of the treatment can be, because I think a lot of people are learning a lot about thermal energy devices, but very often they're expecting more than the thermal energy devices can deliver. So a consultation is critical to get realistic opinion about what your outcome will be. So I hope that was helpful. I wish you the best of luck, and thank you for your question.